So Tourette syndrome is basically defined as when a person is suffering from these complex motor or the vocal tics, and along with that, the person has the obsessive compulsive disorder, and on the other hand, he has the attention deficit hyperactivity syndrome as well. And all of these conditions or all of these clinical features or the clinical manifestations are present for more than a period of 1 year. So this is the condition, so this is the criteria which should be present whenever we are diagnosing a person to be suffering from Tourette syndrome. Then there are a lot of disorders, neurological disorders, organic conditions that can mimic a condition of tics as well. And that basically includes the Huntington's chorea, or which is also known as the Huntington's disease, in which the person has those rhythmic contractions or the rhythmic extrapyramidal movements in the body. And again, it's going to resemble normal tic, which is again involuntary in its action. It is repetitive and is compulsory, and the person has those urges or premonitions before performing those acts. So it's again very important to distinguish between these two conditions. Another condition which can mimic the tic disorder is the viral encephalitis, and again a lot of laboratory tests can be performed in that particular person, and this is how we basically differentiate and get a conclusive diagnosis of the tic disorder in a person who is having those rhythmic, sudden, involuntary movements, and he has basically presented to you with those complaints. The differential diagnosis is, again, we've already discussed, and we'll be discussing in detail this differential diagnosis in this section as well. And then we'll be moving on to the role of genetics in the formation of these tics. As we've already discussed, there are a lot of environmental factors as well that may play a role in the development of these tic disorders. There are these infectious state. Post-viral phase is a phase in which the person can develop these tics, and it can be one of the causes of the development of the tic disorders. And on the other hand, we have the genetic predisposition of a person which make the person more prone to the development of these tic disorders, or a condition which is known as Tourette syndrome, characterized by tics in that particular person. Then we have a lot of comorbidities that can also coexist in this person, which is also having that tic disorder, and we'll be discussing all of these comorbidities along with this condition of tic disorder in this particular fifth section. Differential diagnosis, it basically includes a transient tic disorder of the childhood. So we've discussed this variant as well. This transient tic can be of the vocal type as well as it can be of the motor type in that particular person. The prenatal or the perinatal insults is one of the causative factors for the development of this childhood tic disorder. The congenital CNS defects can be developed through these insults or through these traumatologies that the child can bear through. The birth defects is one of the factors or the causative factors over here. And then there are these infectious or the post-infectious state that can present over here as well. The post-viral encephalitis, HIV infections of the central nervous system can be one of the factors over here that we can go through, and that can be one of the causative factors for the development of the tics in the childhood in that particular person. Then we have another disease which is known as PNDS, PANDAS, or Lyme disease. So it's another one of the infectious condition that can arise in a child, and it can again develop into the tic disorder or the transient tics of the childhood in that particular baby or in that particular child that we're talking about. The differential diagnosis, it includes the head trauma. Then we have the toxin exposure. Usually the people will give you a history, a positive history of the head trauma, and after that they develop that particular tic, may it be focal or may it be of the motor type. The toxin exposure is again very important. Toxins such as carbon monoxide and gasoline are quite notorious for the development of these tics. The drugs that lead to the formation of the tic disorder can include the neuroleptics or the levodopa. Then we have the opiate withdrawal or amphetamine. So the withdrawal syndromes can sometimes consist of such kind of tic disorders in these people. Lamotrigine is one of the drug that is quite notorious for the development of tics in a person. Chromosomal abnormalities, they include the presence of the XYY. Then we have the double XY. And then we have the Fragile X syndrome. So these are the chromosomal abnormalities that make the person more prone, or that can be included in the risk factors for the development of the tic disorders or the Tourette's syndrome in a person. Then we have the autism and the Asperger's syndrome. So these can also be the comorbidities that can also prove to be the risk factors in that particular individual. A person who is suffering from autism or who is diagnosed to be suffering from an autistic spectral disorder or the Asperger's syndrome can develop a tic disorder. The genetic disorders would include the Hallen-Wars-Spatz disease. It's one of the disease or the disease phenomena. Then we have the Wilson's disease, that is basically the deposition of the copper or the excessive copper in the body that was characterized by the Kayser-Fleischer's rings in the pupillary region. That was the characteristic of the diagnosis of this disease, which is known as the Wilson's disease. Then we have the hyperexplasia. Then we have the Rett syndrome, and then we have the neuroacanthosis. So these are the range of disorders, or these are the range of comorbidities in which the person may also present as to be having a tic disorder, or may also suffer from some sort of a vocal or some sort of a motor tic disorder that he or she is suffering from. Now, when we go through the genetics of the Tourette syndrome, it's again very important. There are a lot of genetic abnormalities, as we've already discussed. There is a XXY condition, then there is a XYY condition, and then we have the Fragile X syndrome. So these are the characteristic genetic abnormalities that lead to the formation of the tic syndrome in that particular person as well. The family studies have demonstrated the TS is, or the Tourette syndrome is inherited. So a lot of research work has been done in almost the 1800s in which it was detected that is Tourette syndrome is basically an inherited form or a genetic abnormality that make the person more prone. The first degree relatives of the proband are at an increased risk of the development of the Tourette syndrome. So the increased rates of the chronic and the transient tics among the first degree relatives is very important. Twin studies demonstrate the 8% concordance in the dizygotic twins and the 53% in the monozygotic twins. They are more prevalent. If all the tic disorders they are taken into account, the dizygotes are 22% concordant and the monozygotes are 74% concordant in this case. Incomplete penetration or concordance. So this is one of the causative factors or one of the genetic abnormalities that is present in this particular person or this particular baby who has developed this Tourette syndrome. These psychosocial comorbidities, they basically include the children with Tourette syndrome often have difficulties at school due to this gesture, and up to 1/3 may be diagnosed with Lyme's disease as well, more related to the comorbid attention deficit hyperactivity syndrome than the tic symptoms. So these are the comorbidities. Children with Tourette syndrome have increased difficulties in developing the relationships and socially being helpful or socially being functional. So these are the areas that have to be worked on when you have a child who is suffering from Tourette's syndrome. So in this section, basically, we summarized the diagnosis and then the comorbidities that occur along with this condition, which is known as Tourette syndrome. May it be the psychosocial comorbidities or may it be the organic disorders that can coexist with such kind of a tic disorder. So that is the end of this section. Thank you for watching sqadia.com.